and Sudan. Now, these figures, 570 new cases, it represents a 49% decrease in the number of new cases compared to the previous week. And unfortunately, we see that the DRC reported 2 new confirmed and 551 new suspected cases with 10 new deaths. This is the largest number during this week, with a case fatality rate of 1.8%, while Sudan reported 7 new confirmed and no deaths in Sudan. Cumulatively for monkeypox on the continent, 5,227 cases for this year, including 568 that are confirmed and 4,659 that are suspected, 137 deaths, giving us a cumulative case fatality rate of 2.6% in 12 of our member states. We continue to monitor this very closely with the affected countries, and those that are having higher risks, we are also working with them to mitigate cross-border surveillance, to have cross-border surveillance to mitigate any importation of cases. Fourth is Rift Valley fever, and this now is largely in Mauritania. Since the last briefing, 6 new confirmed cases and 32 deaths, giving a week of 11% as a result of Rift Valley fever in Mauritania. And definitely is just 100% increase in the number of deaths compared to the last report. So that situation continues to concern us as we plan and work with the government of Mauritania to contain that particular outbreak. So cumulatively, for this yellow fever, we've seen 10 confirmed cases, 56 suspected, and 6 deaths, which gives us a case fatality rate of 8%. Now, when we look at Lassa fever, since the last briefing, 121 new cases, including 8 that are confirmed, 100 area, 9% decrease in the number of new cases compared to the last week. Key countries, and finally is getting the right training for particularly clinical staff, so that they have a higher index of suspicion and we can be able to identify if there's any spread of this of Lassa fever in not just the endemic countries, but also in the neighboring countries. The 6th outbreak is cholera. Since the last briefing, we've documented 750 new cases, including 273 confirmed and 477 suspected, 8 deaths during this week, giving us a case fatality rate of 1.1% due to cholera. And that and the deaths were reported from Malawi and Somalia. There has been a steady increase in the number of new cases as we look at the trend in the past 2 weeks, with Malawi reporting 263 new confirmed cases and 4 new deaths, while Somalia is reporting 487 new cases, which includes 10 confirmed and 477 suspected, with 4 new deaths due to cholera. Cumulatively, over the last 1 year, we've documented 40,805 cases, 5,000 of those confirmed, while 35,000 of those are suspected, 610 deaths, giving us a cumulative case fatality rate of 1.5% across 14 of our member states from the beginning of the year. We are strengthening surveillance as we work with sanitation experts at country level to ensure that it does not spread beyond where it is currently. 7 is measles. And since the last outbreak, we've seen 17 new cases, including 3 that are confirmed and 14 suspected. No new deaths have been reported. We see that cumulatively, we have documented 181,350 cases, including 29,000 confirmed and 152,000 suspected, 2,268 deaths, giving us a case fatality rate of 1.3% cumulatively across the 24 member states from the beginning of the year. So measles continues to be a risk for public health on the continent, and we continue to work with our member states to strengthen surveillance and case management as may be necessary. Now, when we look at H5N1 on the continent, South Africa reported 508 new cases and 501 new deaths in poultry and wild birds from within the country. Cumulatively, when we look at all the member states affected, we see all the 13 member states affected, we see over 4.2 million cases and 1.5 million deaths in birds, which gives us a case fatality rate of 36%, because this is a very highly pathogenic, very easily transmissible, let me say, avian influenza, H5N1, that is being reported in poultry and wild birds. No, not yet in the human population, but we track it very closely so that it does not jump from poultry and wild birds into the human population. And our One Health team are working very closely with these countries to ensure that we keep everything under good control and does not come into the human population, while keeping the numbers as low as possible, not to affect the economic activities of those who are keeping these domesticated bats. Dengue fever in Saotomian and Principe. Since the last briefing, 108 new confirmed cases and 1 new death, giving us a case fatality rate of just under 1%. All these have been reported only from Sao Tome and Principe. And this is a 52% decrease in the number of new cases since the last briefing. And cumulatively, we have seen about 1,000 confirmed cases and 3 deaths, which gives us a case fatality rate of 0.3% for dengue fever. We are working with the Ministry of Health in Sao Tome and Principe, particularly around community sensitization in the areas that have been affected, so that we can control that particular outbreak. Now, let's shift now to what is happening here in New York. We've had a week that is full of events, formal and side events, but I would like to point out 3 important events that we've held. And those of you who are following our official sites, you will have seen some of those outcomes. The first was an event at the Africa Center last Sunday, where we engaged with our partners and the public on what Africa CDC is, what we do, the challenges we face, and our vision going forward. Very well received, a lot of robust discussions that we had, and indeed we see this as a way of making sure that people understand Africa CDC beyond COVID-19, because we do a lot more than that. Second was a side event by our heads of state, which covered workforce development on the continent of Africa. Our communique has been issued, and that is going to be made public in a little while after it goes through the usual processing within Africa CDC and the Africa Union. It is very important to point out that during that particular workforce development side event, it was very clear that there was enhanced interest in ensuring that Africa has a standby force that we can be able to call upon, including community health workers, that we can be able to call upon anytime there is an outbreak of any nature. And we thank our heads of states for giving us very clear direction that we'll be sharing in that communique. The third, yesterday we had an event of the new public health order. Again, our heads of states gave very clear direction, and that has been captured in a call to action. There is urgency in what needs to be done, there is urgency in ensuring that our member states, our partners, all understand fully what the new public health order is about. And again, that particular call to action is going to be made available very shortly. Then we had numerous meetings that covered three very important areas. Community health workers I've already talked about. Apart from our own side event, the meetings we've been holding with partners here is very clear that there is an increased interest in ensuring that we get community health workers functioning properly on the continent. Our heads of states at the AU Assembly have already made the decision that we need at least 2 million, and we are working towards that number. Second is vaccine manufacturing. That momentum is picking up again, and there is a lot of interest in getting local vaccines manufacturing on the continent, and we are looking at all mechanisms, opportunities to expand and increase the speed of that happening. And finally is financing. Financing for pandemic preparedness and response. For us, as Africa CDC, we see that in the context of the new public health order, because that is the fourth pillar of the new public health orders. So we continue to engage with partners, and we are looking forward to a very comprehensive report at the end of the week when we are done with the side meetings and the formal meetings here in New York. Thank you very much, and back to you, Nick.
Okay, thank you, Director. It's all of a summary, but that was quite lengthy, if you may. But it's a very clear picture of all of the public health events that are happening on the continent of Africa, and of course, diving into the activities ongoing at the UN General Assembly. So we're going to proceed into our questionnaires because we've got just around 10 minutes based on our time set for today, so that we give you a couple of minutes to prepare for your other engagement. We're going to start our questions. Paul, I see your hand has been up a while. Let me start the questioning with Judith Akolo, our colleague from the Kenya Broadcasting Corporation. And then I will go to Paul. Then I see a question from our colleague Sarah as well. So we start with Judith. Judith said, good morning, Dr. Ahmed. My name is Judith from Kenya Broadcasting Corporation. Her first question is, what is the state of preparedness to contain the Ebola outbreak in Uganda, so that the neighboring countries are protected from the highly contagious virus? So I think the issue around the Ebola in Uganda is going to be one of our concerns today. That's Judith's question. Over to you, sir.
No, thank you. Thank you, Judith. State of preparedness is good. The response by the Ministry of Health and the whole government in Uganda has been very rapid. They shared the information as soon as it was confirmed, and they have mobilized to contain the virus within the outbreak area. Second is high alert at the border points so that we don't get anything slipping, not just from within the area where the outbreak is, but also beyond their borders. And that's why I was saying that we are working closely with the neighboring countries to ensure that we have good surveillance mechanisms in place, and we can pick any case that may go beyond the immediate area of the outbreak. So preparedness, level of state of preparedness, I will make that good.
Thank you, Director. So just in the same context of Ebola, Sheva Javin from DevEx, she says the new Ebola outbreak is in the Sudan, I guess, is the Sudan strain. Let me take that again. The new Ebola outbreak is the Sudan strain, which is a strain that doesn't have an approved vaccine. How will this impact the response compared to previous responses to contain the Zaire strain, where a vaccine is available? Will containment be more challenging?
No, thank you, Sarah. A containment of both strains, whether it is the Zaire or the Sudan strain, containment follows very similar pathways where members of the public and clinical care is concerned. But in terms of prevention, this is different because the Zaire strain has approved vaccines, but the Sudan strain does not have approved vaccines. So in that way, protecting the community where the outbreak is, and protecting our health workers becomes more challenging in the absence of an approved the vaccine. And this is really giving impetus to the need for Africa to develop as its own priority vaccines and not to wait for others to do it for us. So it's really motivation for us that we are on the right path, demanding for local production of priority vaccines, therapies, and diagnostics. And we'll continue to use some of these outbreaks as a very clear advocacy for the need for us to be able to strengthen that. But for prevention, it is a challenge because there's no vaccine. But for containment and preparedness and response, it is exactly the same, whether it is Zaire or the Sudan strain.
Thank you. We move to Paul, but just before we allow Paul to speak, colleagues, the WhatsApp number, I'll use your WhatsApp number, is +251 94550 2310. Of course, that's the number, but you can come through on the Q&A or as well raise your hand like Paul has done. Paul, let's come to you for your question.
Yes, thank you very much. So my question is around recent developments around antimicrobial resistance. A network which Africa CDC is part of reviewed that only 1.3% of 50,000 laboratories in surveyed countries are even doing bacteriology testing. And among those that are doing bacteriology testing, only 5 of 15 are actually testing for antibiotic-resistant pathogens, which reminded me of a framework that Africa CDC launched in 2018 that is going to...
We're losing you, Paul. Hello, Paul, are you with us? Hello, Paul, are you still with us? Okay, I think technology is having a tour. So we'll bring back Paul once his connection is good. Let's take Julie's second question. Julie's second question says, is Africa CDC working with various governments to help reduce the consumption of bushmeat by some communities, as both Ebola and monkeypox are zoonotic diseases believed to be coming from bushmeat?
Thanks, Judith. We provide guidance to our member states on the sources and possible sources of pathogens, whether viruses, bacteria, or otherwise, that may be able to cause illness. The local context is very important, so that any advice being given to the public has taken care of the local context. And it will be different from one country to the other. The source of the virus is known in the different countries. Some will be from bushmeat, others may be from bats and other sources. So within that context, the risk communication units of these different ministries of health then couch their messages to fit that local context. You don't go banning, activities that have been conducted over a long period of time without adequately preparing the population for that. But for us, we do provide to our member states clear advice on how they can be able to address the issue of where the source of a particular virus, bacteria, or other pathogen would be, and we leave to the country to use its local system of its local legal framework and the local cultural and social context to be able to pass on that message. But we must address it, and it is something that when addressed, we then reduce the risks to a transmission from a reservoir within the animal kingdom into the human population.
Okay, thank you, Director. Paul is back. Let's try again. Hope technology doesn't fail this time. Paul, go ahead.
Yes, thank you very much. Apologies for that. So my question has to do with the Africa CDC's what you want to do with the framework for antimicrobial resistance that expires next year, 2019 to 2023, considering the wide gaps that are still existing in antimicrobial resistance tracking in Africa. The few numbers of African countries that are doing the tests and are testing everything. Well, my second question is about your assessment of global funders in supporting initiatives that are critical to healthcare in Africa. We found that the Global Fund's replenishment announcement is still short of $18 billion. So what do you think this suggests regarding how global health is funded, especially those that have to do with African countries?
Now, thanks, Paul. On AMR, one of the reasons why we made this a priority for the continent and developed a framework way back in right at the beginning of Africa CDC's establishment in 2018 is because it is an epidemic that is very silent, and you only know when you do regular testing. We've come up with a framework, and we have been encouraging our member states to use that framework to build appropriate capacity locally at country level, and then actually do testing on a regular basis. The survey that we conducted in 14 countries was very clear. The gaps are huge. The number of laboratories that are actually doing the testing regularly is very small. The number of laboratories that are doing any testing at all, not even regularly, any testing at all is very small. The capabilities of the laboratories is still low. And the understanding of the need to do this testing on a regular basis amongst clinicians and also amongst laboratory scientists is also still low. Policy frameworks are new on the continent, and therefore for us going forward, we are actively engaging with our member states, and that is one of the recommendations that came out of the meeting 2 weeks ago that we had to disseminate the results, that a lot more needs to be done for policymakers to understand, appropriate resources to be secured, and as Africa CDC, we have committed to build that capacity in each and every country so that we can be able to have data that guides us on the state of antimicrobial resistance on the continent. It is a priority for us, and we are putting our resources into expanding that capacity in the countries on the continent. Secondly, in as far as global financing is concerned, clearly there are competing priorities. And the replenishment of the Global Fund yesterday hitting for just over 14 billion, not reaching the 18 billion, is a testament to those competing priorities. During the pandemic, we had a lot of focus in public health. We need to ensure that that focus is not lost, and we need to ensure that whatever new resources are coming, whether it is through the Global Fund or other mechanisms, the FIF, for example, or the Africa Epidemics Fund, we need to ensure that those who need to contribute, they see this as an investment in socioeconomic infrastructure of the world, and not just an area where money is being used as a service. So we are talking with funders here in Africa, well, in Africa as well as elsewhere in the world, and we are making that case that Africa must be part of the global health security architecture, and protecting Africa is protecting the world, and vice versa. Those who have manufacturing capacity should not be keeping their products away from those who do not have the manufacturing capacity, because this is a two-way street. And that is the message that we are passing here and elsewhere, that so that funding to health security particularly and other pandemics that are silent is not reduced, and what we have is used for the priority areas, particularly here in Africa. So it's a conversation that continues, Paul, and we will continue to keep you as journalists updated as we make progress. Thank you.
Okay, thank you, Director. Thank you, Paul, Sarah, Judith, for coming through today. Thanks to all of the other colleagues who are online and following the conversation. Thanks for keeping up with the time. We are almost 5 minutes beyond our prescribed time for today, but I think we managed to do that. Just before we go, Director, just your 2 or 3 headline points today for today's conversation, and then we wrap up.
No, thanks, Nick. And first key message is that Africa has many other outbreaks to deal with. So the health security situation on the continent is still highly risky, as we see with the new outbreaks coming in now and then. And we need to cover all these outbreaks so that there is visibility of the health security situation on the continent. This is one. Second is vaccination remains the most important tool when it comes to controlling transmission, particularly of vaccines amenable diseases like COVID. And therefore, we need to ensure that we increase the level of vaccination here on the continent, even as we deal with the other outbreaks that are coming. So vaccination. The third is that the global discussions need and must accommodate African priorities. We are working very hard towards that, but we need our colleagues, particularly the journalists, to point these out more regularly. That any process at the global level, whether it is an instrument that is being developed, or it is a financing mechanism that is being established, or it is technical tools that are being developed, we must ensure that African voice, African position, African priorities are part of that. And this is some of what we are expressing here in New York. It's receiving good response, and we would like that to be kept as a priority discussion point, that the global level discussions must always accommodate regional and continental priorities and voices as we complete the process for developing those instruments, whether they have of a legal nature or a financial nature or a technical nature. So these are the 3 things that I would like to share with you today. Thank you.
Thank you, Director. Message really clear. Very, very clear for all of us. Let's approach the global health architecture using the whole of society approach so that everyone voices here based on our different contexts, and we are able to solve our problems in our context, especially for Africa. Colleagues, I want to say thank you to our journalists who always make the time to be with us and amplify whatever we are saying and doing at Africa CDC to the population across Africa. We appreciate your effort. We also want to say thanks to Director and the team there in New York who could make it to wake up at 4 a.m. just to be here and provide this very important information. Thanks to our interpreter. He's always on the standby and helping us to get across in French as well. And to the colleagues, both at the AU communication team and the Africa CDC team, kudos to all of you for making this happen. We're going to be with you next Thursday, the same time, 12 p.m. East African time. For now, we say good night to those of you who are going to bed, and have a good rest of the afternoon to those of us who are in the afternoon. And to those of you just starting your morning, have a very good day, and cheers. Good luck to all of your meeting, Director and the team. Bye-bye for now, and see you next week.